know of VMV hypoallergenic, safest, most proven effective care on the planet, which we prove by omitting all 109 known and published contact allergens, and by publishing our own clinical studies. This count over 80. And our mission is to save the world's skin. We're doing another installment on Ask a Skintellectual, where we ask you to ask us questions about skin or VMV products, and we get to them. So stay tuned on Instagram for our question sticker to ask us questions. We'll do either video recorded answers, and we'll write them out on Instagram. Make sure you subscribe to our YouTube channel so you don't miss these Ask a Skintellectual answers. And please remember to comment if you have any additional questions that you'd like us to answer, and certainly share if you feel like this will be helpful to someone. Our first question is, my patch test said I'm allergic to sunflower, so should I not consume it either? So food allergies are determined by a prick test, usually on your arm, and that's for food, dander, dust mites and stuff. For a patch test, for a skin allergy rather, it's determined by a patch test which is stuck on your back. The two don't always correlate so perfectly. Sometimes they do, but they don't as often as you would think. Most of the doctors we work with would suggest, if you have both skin and food allergies, to work closely with your dermatologist, your patch testing doctor, and your allergist together to see where those two do cross over. The next question is products to whiten the groin area, especially if you have eczema or sensitive skin. The first step is to determine what is causing the darkening. We have a nice live stream that you can find on YouTube. I think it's also on IGTV, on hyperpigmented contact dermatitis, which can be really common in the areas of contact with underwear, for example. So under the breasts, certainly the groin area, even the waist area. So you want to look at, talk to your dermatologist, maybe get a patch test and see if you're allergic to fabrics in your underwear, so stretchy materials, latex and rubbers, or dyes in your fabrics. Look up Cottonique.com. They make underwear specifically for people with clothing contact dermatitis. A patch test can go a long way to help you identify exactly what it is. Maybe it's not the fabric, but maybe it's the laundry detergent that you're using, for example. Next question, how to lighten stretch marks. Stretch marks respond really well to the Enerjet machine. It's a new machine that doesn't use radiation. It uses air jet propulsion instead and has fantastic results, and it can go a long way towards lessening stretch marks. And our Illuminance line is great for hyperpigmentation, but again, we look at what is causing the darkening of the area. Sun and light screen used every day can also really help. But as far as stretch marks themselves are concerned and other scars, the Enerjet is a great machine, great procedure. Next question, I was recently diagnosed with seborrheic dermatitis and was given topical steroids by my dermatologist, but I'm also thinking of other ways to lessen dandruff flares. Please recommend stuff. Okay, yeah, topical steroids, if your doctor prescribed them, should be taken, but they shouldn't really be used for longer than 2 weeks, 4 maximum. So a focused prevention regimen is really more important. A patch test is extremely helpful here because you really more accurately identify what you in particular need to avoid in your hair care, styling products, maybe even your laundry detergent when you're sleeping on your pillow. Other than that, we would recommend an allergen-free regimen for hair and scalp care with the Essence skin saving line, so superwash or Clark wash and conditioner. And then a nice tip that we do is either applying Boo Boo Balm before you shower and Red Better Calm the Heck Down Balm when you think that there's flaking and a bit of a flare. It works very, very well. Can comedone extraction cause scars? And the answer is yes, if not done properly. The technique that we use at VMV is from acne surgery by dermatologists. So we made sure that our team was trained really, really specifically. So if you notice, their steps are very, very careful. And we use a proper comedone extractor. There are two types. We always use the proper comedone extractor. Sometimes there are services that do hand extraction, which we really do not recommend because there's a higher risk of spread of bacteria and of scarring. What do you recommend for use in the bikini or vaginal area for daily cleansing? Just a very gentle wash, like Clark wash or super wash. The vaginal area, despite the plethora of products that imply that women have something wrong down there and need extra cleansing, is completely natural. We have a very, very complex, wonderful, successful, and healthy balance in our microbiome in the vaginal area, where we have healthy natural microbes, just like in all of our bodies, skin, gut, everything. And that balance is fairly easy to throw out of whack. This is why when you take antibiotics, you're often recommended to take yogurt or kimchi to offset that, because antibiotics will kill a lot of the bacteria, even the good bacteria that we have down there. So using vaginal washes that are known to upset that balance, because God forbid they have antimicrobials in them, not a good idea. And using vaginal washes that are fragranced, because again, beyond the sexism and misogyny of it all, there is no need to correct any smell in the vaginal region. If there is a sudden change in odor in the area, you need to talk to your gynecologist to rule out a possible infection. Otherwise, you don't need fragrance down there. And fragrance in vaginal washes can cause real problems because it is a top allergen. Even if it's pure, organic, natural, and it's from a rose that you grew yourself organically, fragrance is fragrance and is a top allergen. If you're allergic to it, it can cause real problems, redness, itching, etc. Other things that tend to be in vaginal washes, dyes, preservatives, allergenic surfactants, all of these things you don't need. So Essence Clark wash is a great idea. Super wash is a great idea. If the area is very sensitive, recovering from a skin irritation, for example, virgin coconut oil alone is a great idea. Is Brazilian wax or waxing in general recommended? And the answer is sure, when done properly in a spa or with someone who does a service with very good hygiene, ideally allergen-free waxes, anti-inflammatory care, and who's very careful about the temperature, because heat is inflammatory and can cause minor burns, which can cause hyperpigmentations after. Lotion for eczema, question mark? And our answer to that is we need a more specific diagnosis first. Is it atopic dermatitis? If so, then a patch test to more accurately determine your allergen so you can practice better targeted avoidance is key. And we have a great video on eczema care, learning more about it, what causes it and how to care for it, and even a day-to-day step-by-step regimen that includes a lotion. So check that out on YouTube. Facial wash and moisturizer for pregnant women. We have a great article for pregnancy and breastfeeding, but basically there aren't a lot of skincare products that have ingredients with a molecular size small enough to penetrate the epidermis, dermis, bloodstream, get to the uterus, and get to the baby. So you can actually use a lot more than you think. Now, because of hormonal changes, we might also be dealing with dryness or acne. So we are anyway looking at gentler things, non-comedogenic things, and if dryness is an issue, certainly more moisturizing things that have more occlusive and humectant properties. We have a Grandma Mini Mom and Baby line, which was designed precisely to share with pregnant parents and their babies when they come. So check that out. That's definitely helpful. Some notable exceptions not to use are retinoic acid, because it is a known teratogen, which can affect the formation of the embryo, and salicylic acid, and steroids. Topical steroids can penetrate the dermis. So that's pretty much it. But check out that article. How to lighten dark under eye circles. So this can be caused by several things, including just shadows. You might have very deep set eyes, and so the protruding brow bone might just cause shadows, and the deep sockets of the eyes can make the under eye look dark. In which case, actually, some dermatologists have an ingenious little trick where they do fillers in key areas of the face to make this look less sunken, and it can lessen the look of the darkness in the under eye area. There's also lack of sleep. It could be a vascular issue. It could be hyperpigmentation. So the first thing we would recommend is go see a dermatologist for sure, to just make sure you know what is causing it. And once you know the cause, you'll be better able to decide on a treatment plan for it. Is it okay to use no oil as a face moisturizer and apply Armada sunscreen after? Absolutely. In fact, because of the molecular size, we would normally recommend that virgin coconut oil is the last thing that you apply in a regimen, except obviously during the day, then you'd follow with sunscreen. Oh, certainly at night, it would be the last thing you apply. And we have a nice, helpful article on vmvinskin.com about the suggested order or the suggested sequencing in which you apply skincare. So check that out. Is monolaurin good with nail fungus? It could be. Monolaurin is a very, very good clinically proven broad spectrum antimicrobial for bacteria, viruses, and fungi, but this is not something to guess at or self-medicate or self-diagnose. You need to talk to a dermatologist to more accurately identify what you're dealing with. Is it actually a fungus? If so, what type? You might need to do a culture and sensitivity test to make sure you know exactly what it is and what it'll respond to. How much is a patch or photo patch test, and where can I get it? Prices can vary, which is why patch tests have to start with a consultation. Usually a specialist will first figure out how many allergens, what kind of patch test tray you need, and that will determine the price. In the United States, you can look at contactderm.org to find a patch testing doctor in your area, enter your zip code. And in the Philippines, we do it at VMV Skin Research Center and Clinics. So drop us a DM or a private message and we'll help make that happen. I'm diagnosed with mild to severe atopic dermatitis. Any skin regimen suggestions? Lots. First and foremost, a patch test, because one of the most effective ways to really manage even severe atopic dermatitis is knowing what your particular allergens are, not just in skincare and health care, hair care, but also in laundry detergent, in clothing, fabrics themselves, in glasses. If your patch test shows that you're really allergic to nickel, you might not be able to use, for example, metal frames, or might need to be extremely picky about the metals that you get in everything, in your phone cases, in your phone itself, in your glasses, in your gadgets, in your jewelry. So patch test is fundamental. Beyond that, we have a step-by-step daily regimen that is spelled out really clearly in a video on YouTube. I think it's called The Best Regimen for Managing Eczema. So check that out. Okay, that's it for this series of Ask a Skintellectual. Please definitely continue asking us your questions. Type them out in the comments in our videos on YouTube or anywhere that you follow us on Instagram or Facebook or Twitter, and we'll make sure to answer those questions. Definitely comment with other things you'd like to learn more about in our live streams or in our videos or other content. And please don't forget to like us on Facebook, follow us on Instagram, and subscribe to our YouTube channel. And remember to click the little bell button so you don't miss our new content as it comes out. I hope you found this helpful, and keep the questions coming. Bye.